We know historically most babies born in an unplanned place outside a hospital, we're up against the environment. We know that they generally are admitted into hospital cold, and unfortunately that means that those babies need to stay in hospital for at least 24 hours to help support that transition in life. So I knew from being a midwife that there was a real need to try and prevent this and have a real need to record babies' temperatures more frequently when they're born outside a hospital. But we just didn't have the equipment, it wasn't available. I'm Helen McAdam. I'm a senior lecturer at Sunderland University on the paramedic degree course. I'm a nurse, a midwife, a critical care specialist and co-inventor, co-owner of NeoBand. The idea and the concept of the thermometer and using a more reliable, effective thermometer in newborn care started way back in 2018 when I was actually working for the ambulance service, training paramedics, working with paramedics, specifically on elements of maternity care and newborn care. And it's where I discovered that there was a limitation on the thermometer devices that they used to take temperatures on a newborn.
I think the research at the moment shows that our newborn babies need to be kept warm, optimal warm, and it's really important that we are able to check that temperature. I think the devices we're using at the moment are not the most accurate. I work for the university teaching on a BSc programme for our new student paramedics, so I'm bringing our new paramedics to life from this, and it's quite important that we're using new innovation to treat our patients.
I came up with a really bizarre, what felt like a bizarre idea, using a meat thermometer sensor and a disposable tourniquet, and attached it to my actual self, and it actually worked, and had this idea for probably a couple of years until I met Andrew Turner, who is an innovations engineer, and I kind of pitched the idea to him and said, is there a way we could do something more innovative, a bit more technical? And so yeah, that's the start of the journey of NeoBand, and it's developed over time with the support of Andrew Turner, who then brought me to CPI, where we have now got a working prototype.
NeoBand came to us with the challenge of developing a wearable temperature monitor for premature babies that would track the temperature of the baby from wherever they were picked up and then through the journey in the back of the ambulance, where temperatures can really drop and there's a critical period before they reach the hospital, right through to when they reach treatment at a hospital. I think this project highlights CPI's ability to combine a various range of technologies and integrate them together into a working prototype.
So CPI, I've obviously, with them being based on the science park, I'm aware of their capabilities. They had big investment into some great equipment. I think the knowledge inside, it's like a one-stop shop. You've got a bit of software in there, a bit of electronic design, a bit of manufacturing experience and all of that, and all of them were key elements in this project in terms of the way it was going to be designed.
The impact of NeoBand, my ultimate aim with this product is to reduce the number of babies that are potentially hypothermic, particularly those babies that are born in unplanned, out of hospital situations. It kind of goes beyond that as well. As well as making sure babies' health and the very first minutes, moments of life are the best that we can give them. It's about that continued maintenance of the temperature. We know that it doesn't just happen outside a hospital. We know that there's often babies still get cold in hospital. So it's about enabling the clinicians to have that really good tool to help them make clinical decisions and guide their interventions.
The impact that a product like this can have, not just on, saving babies and making babies more healthy in terms of potential brain damage and that, it's just how much does that affect the other people, mothers and all of that out on the bigger picture. It has a ripple effect to many people if there's an issue with a newborn baby, so it helps cure a lot of other people's pains as well.
This project really aligns with CPI's vision of enabling a healthier, more sustainable future through deep tech innovation by creating a product that potentially saves the lives of babies and also, in the meantime, helping a small business in the UK.